announcements. We have 2 upcoming in-person Team Steps Master training courses for the year that still has capacity left. One is November 9th and 10th at Houston Methodist, and the other is December 6th and 7th at Tulane. If you're looking for a virtual option, we offer a Team Steps for Change Leaders and Champions course that actually Melissa's colleagues at Duke facilitate. So if you're looking for more of a focus on implementation of Team Steps and a bit more of a refresher on the tools, this is a really great course. It's about 2 hours of commitment a week. And there's a 90-minute live session once a week over the course of about 7 weeks. So all of our courses are hyperlinked there. Rachel will chat them in as well. We offer team discounts, so check out more details there and let us know if you have questions. Our next monthly webinar is October 12th, and it's Flipping the Leadership Algorithm, and that is also currently open for registration. So I'm really happy to introduce you to today's presenter, Melissa Siegel. She's the Director of Culture and Wellbeing at Duke University Health System. So enough of me, I'm going to hand things over to Melissa.
Thanks, Jen. Really appreciate it. And I'm really happy to be here today. Thanks for all the warm wishes also on the chat. I tend to be pretty interactive, so I know there are a lot of people here today, but we'll use the chat several times, so would love to just hear from you as we go through the presentation. As I'm informal, if you have questions along the way, please put them in the chat. I'll try to answer things as we go along, but to the extent, if I miss something, Jen will grab me at the end and we'll answer the questions that you have. So I want to just start with today's objectives so that you know you're in the right place and you know what we're going to cover. We're going to describe the types of distressing events and the variability of responses. We're going to learn about options to provide support after distressing events to our healthcare team members, and we're going to go into detail about that. We're going to learn how to provide direct peer support. So we're not going to have the opportunity to practice today per se. We tend to try to do that in our smaller sessions, but you'll get a little taste of what we do, and you'll get some tools to take with you. We're going to understand the components of training volunteers and who actually do the support of team members. And then this is super important. We're not going to spend a lot of time on this, but we do want to recognize that a comprehensive program is not just about supporting, but also preventing. And so want to just be clear about that, and we'll talk about that a little bit at the end. So I want to start and talk about some types of distressing events, right? What are types? And you all have seen probably a lot of these things. So one is medical error. That could be my own medical error or a colleague's medical error. An adverse patient event, right? A patient could unexpectedly die or have another adverse event in the course of treatment. Workplace violence, that could be verbal or physical harm that's caused sometimes by patients, sometimes by team members. Moral injury, where someone's providing what they would consider to be futile care or care that just raises those ethical questions for the provider. We've had adverse team member events where a team member unexpectedly dies of death by suicide or another tragic event. Staffing shortages, we've all seen this, right? That can really be distressing to our team members. Disrespectful behavior could be among team members or others. Microaggressions is just one example of those. Professional challenges, you didn't get that promotion you were expecting, or there's a challenging work environment. And then, of course, we all recognize that our personal stressors do bleed into our daily lives, right? So that could be caring for children or aging parents. That could be a divorce situation, a pet sick, you know, lots and lots of personal stressors that could impact us. So lots of things up here. And we want to think about what is the impact of those distressing events. And the reason that I share this at the beginning is that as we're listening to our colleagues, as we're validating, it's really important for us to recognize the types of distressing events that there are, and also the impact, what's sort of within that normal range, so that when we can say, hey, you know, I hear you, and what you're experiencing is really normal, right? So wanted to just sort of lay the groundwork for that. So distressing events can impact us in all of these dimensions. And what I will say is not everyone's going to experience all of these, right? Somebody might experience only one, or they could come and go at different times. So there's not a sort of one size fits all. When we look at the physical impact, you could feel body pain or tension, headaches, stomach aches, right? Other GI issues. When we think about the impact mentally, you could have sort of slower thinking or analyzing, difficulty concentrating on tasks, or even be preoccupied with the event. Emotionally, again, lots of different impacts. So we could feel sad or depressed. We could be angry, frustrated, irritable, or just have lots of feelings of guilt, shame, feeling overwhelmed. Behaviorally, we see an increase or decrease in activity. It could go either way, honestly. An increase or decrease. Some people eat more when they're distressed. Some people eat less when they're distressed. The same with self-care and work performance. Some people work a lot more, and some people really just can't concentrate and work less. And then, of course, fatigue and sleep disturbances. And then socially, we see withdrawal from others, disrespectful behavior often when we're stressed, and then just sort of difficulty learning and sharing. So again, lots of different possibilities, but just to recognize that all of these are within the realm of normal, and that folks may experience one or more of these at different times after distressing events. All right, so when we look at the emotional support services that we could offer, I've sort of put them in 3 buckets, and we're going to break them down a little bit more as we go along. The first is our Caring for Each Other program, and this is the program that I'm going to spend the most time on today. We offer peer support in the context of this program, both individual and group support, and we'll talk more about that in a little bit. The idea is this is volunteer-based, right? These are your peers who are reaching out to provide support. And there's generally 1 touch point or sometimes 2 touch points. And then that's it for the intervention. So we're going to get more into detail about that. PAS is our personal assistance service. That's our EAP program. So we have professional mental health counselors. They meet with folks up to 8 times per event. And that's just one of the benefits that comes from being part of the organization. And then our critical incident response program. This is a program actually made up of folks from PAS and also some folks from our Caring for Each Other program. And this is when there's a critical event, a mass event. So a severe injury or death, sometimes a suicide by an employee, or a mass disaster. And again, we'll talk a little bit more about that, but just wanted to sort of paint the overall picture and divide that up into buckets. So I want to go in specifically into our Caring for Each Other program, because that's the program that's volunteer-based, where we're offering support just briefly to individuals across Duke Health. And there are 4 components of this program. We have individual peer support, group peer support, emotional support rounding, and conversation with colleagues. And then within those, that could be requested, or right, so I could request support, or proactive, where I'm reaching out to give somebody support even if they haven't asked. And again, we're gonna get more into this in just a moment, but this is our overall program. So individual peer support, it is what it sounds like. This is one-on-one with a volunteer peer to provide support. Generally, there's 1 session, anywhere between 10 and 45 minutes is sort of average. I would say most are sort of 15 to 20 minutes. And then there's 1 check-in. We'll check in a week or 2 later just to say, hey, just wanted to check in, see how you're doing. And then this can be initiated in lots of different ways. It could be a team member who's asking for support, a colleague or supervisor who's saying, you know, my team member could really use some support, or we reach out based on safety reports. And so I want to break that piece down as you might be thinking about what would a peer support system look like in my organization. So the first is we have an online survey, and you can request support via that online survey. So I'd like peer support, and then we have these 6 categories. So maybe if my gender identity is female, I might want to talk to a woman. You know, I may or may not have thoughts around, do I need someone the same age or the same race? Maybe I do, maybe I don't. If I'm a nurse, maybe I want to talk to a nurse, or maybe I don't want to talk to a nurse. So people can choose sort of based on who they are and where they work and who they might want to talk to, what they feel strongly about. And then we match them with someone based on their preferences. So we want to make sure that folks are being reached out to by somebody who's actually, you know, who they want to connect to. The next is we have a 24/7 phone line, and we actually just got this off the ground last month. It's new and super exciting for us. And that's a phone line for urgent needs. So somebody can call that phone line and they press 1 for one entity, 2 for another entity. So depending on where I am in the health system, that phone line is going to connect me to the right people. And I can either leave a message if it's not urgent, or if it's urgent and I need to speak to someone right away, that we have a pager system. So that's another way to get requested peer support. A third way that I could request peer support is when I put in a safety report. That's going to go to a variety of different people. And I can put in as part of that safety report, I'd really like to talk to somebody about this experience. Maybe I experienced a workplace violence incident, or there was disrespectful behavior in the workplace. And so I can check that box. And by checking that box, someone is going to reach out to me and say, hey, do you want to check in? I'm happy to provide support. So lots of ways that someone can request support. And then we actually reach out to people proactively, even when they haven't requested support. And I will say this has been one of the most active parts of the program, and a way that we've actually spread information about the program. So it shouldn't surprise you. Sometimes folks hesitate to ask for help or hesitate to reach out. And so we've done a lot of proactive support to make sure that we're providing appropriate support. So if I get a workplace violence report, then I might reach out, in this case to somebody named Jaden, right? I'm reaching out. I wanted to follow up on that safety report to see if it might be helpful for us to talk about your experience. And so we do that a lot. We also look at data across the health system. So if a particular provider's experienced more than 3 deaths in a week, for example, we'll have another provider reach out to that person to offer support. So we've tried to continually grow this part of our program, looking for signals across the health system and looking at reports, specifically injury reports and safety reports within certain categories. So that's individual support. I will say we also do this for group support. If I'm filling out an SRS, a safety report, I might request group support for my group. When we also see those signals in the system, we can reach out and say, hey, I noticed this happened within your unit. Would it be helpful to provide some group support? So we do this both for individuals and for groups. All right, so group support, very, very similar to our individual support. It's group support by volunteer peers, right? So this is instead of an individual, there's a group involved. That group could be anywhere between 3 or 4 people and 30 people, depending on the size of the group, but depending on what's going on. Generally, there's 1 session. Sometimes there's a second session, depending on what's going on. And then again, initiated in a very similar way, right? I had a team member reach out and say, I haven't talked to my supervisor, but it would be really helpful to have a group support session. So we had a conversation about looping in the supervisor so that the supervisor knew, right? And then set up a group support session. We also have supervisors or leaders reach out to us and say, I think my unit could really use some group support. And then we'll, again, proactively reach out. So lots of ways to make sure that we're providing support to folks across the health system. All right, proactive emotional support rounding. So this is the third piece of our program. These are brief interactions by volunteer peer rounders. So we have volunteers who round throughout the hospital. Sometimes our chaplains also round. We always have chocolate or some other snack. Just brief interactions to just check in. Hey, just checking in, here's some chocolate, want to see how you're doing. And so these are sort of 3 to 5 minute conversations, sometimes 30-second conversations, depending on what's going on. But it's a way just to provide a little bit of extra support. For a long time, we did this weekly throughout our sort of higher risk units, units that were serving COVID patients, or where there were just a lot of individuals who, with a lot of medical complications, or lots of staffing shortages, right? We sort of looked at those signals of which units could use that little extra support, and so we try to do that. And then again, initiated in a very similar way, supervisors or leaders could ask, we could see signals in the system, right? We want to make sure we're providing support to those who need. And then the fourth piece is a little bit different from these other ones. It's support in a similar way, but it's really based around a specific topic. So work-life balance, and this is done all on Zoom, so folks across the health system can participate. It's not sort of site-based. When COVID vaccines came out, we had one around that because people had lots of feelings around vaccines and should I get one, should I not, is it safe, is it not? So just providing that safe space to have those conversations. These are generally one-hour sessions. We have a racial justice series that's actually 6 sessions, but most of them are just 1 hour. And then again, a team member may initiate. Sometimes we'll just hear something in the news and we'll say, you know, I wonder if this might be a good conversations with colleagues. So recently we ran actually several on the overturning of Roe v. Wade. Folks had lots of feelings about that. We've run them on gun violence, just anything happening in the community that people may really be thinking about. We want to make sure we're providing just a safe space for folks to talk. All right, so I'm going to talk just briefly about personal assistance service and our critical incident response program. And then I want to jump into some of the more specifics about what we do in the volunteer interactions. But I want to make sure that you're getting sort of the full picture of our emotional support programs. So the personal assistance service is our EAP program, right? It's that employee assistance program where they do mental health counseling. So assessment and counseling, also management consults about specifically around workplace events. Folks can go for up to 8 sessions per event. And then this is always initiated by the person seeking support. So PAS does not have the capacity to reach out proactively. It's one of the reasons that we make sure we're reaching out proactively in that program. If I want support, then I'm going to need to ask for it. And then the other one is critical incident response program. So again, this is for those larger events, those mass casualties. And this is a very structured response after a critical incident. So there's a consultation and then several individual or group briefings, depending on what's happening, just so folks can sort of process, right? Have a place to sort of process and think through. This is really sort of that immediately after an event up to 72 hours. So it's really a time limited service. And what happens is before or after we might offer other services, but this is very time limited. And then this is always initiated by leaders and in consultation with our CERP program directors. So that's a critical incident response program. You may say, that's a lot of stuff. How do I know where to send people, right? It can be very, very confusing. And so one of the things that we want to make sure is that folks really understand where they send people, what services are for which things. And so we try to make that really clear. The other piece of that is there's always going to be some confusion. And so we want to make sure that we're communicating with each other. So I have at least weekly Zoom calls with the director of PAS. With the directors of CERP, we meet at least generally once a month. So we want to make sure that we're talking pretty consistently. And if we need to send somebody to the other one, we do that. So that's really, really important if you have multiple programs. So here's sort of how we think about it. So these are questions that we ask folks to ask to determine which services they're going to send somebody to. Right, so how many people were involved? Was it one person? Were there a lot of people? How many departments or units? Was it a small unit, a large unit or department, multiple units or departments? And then how many people were harmed? Right, that could be physical, that could be verbal, it could vary. Sort of looking at the intensity of what happened. Was it unexpected or sudden, or is this something that we sort of expected to happen? What was the duration of the event? Was it just boom, done? Or was it something that went on and on and on? What were the level of sensory factors, right? The sounds, sights, smells. We had a gas explosion actually in Durham in one of our Duke buildings. It's already a couple of years ago, right? That was really, really intense. And so, right, a lot of those sensory pieces. And then the relationships between the people harmed and team members, right? How close was that? All right, we also looked at the distress impact. What's the personal level of distress? Or the fear of safety or death. Am I worried about my own safety? Right, that could impact then my level of distress. What's my ability to operate, me as an individual and others in my unit? Are we able to function right in the workplace right now? The higher or more any of these answers are, the more likely services need to be professionally based. So when these are sort of lower level, then we have volunteers who can help that. But if these are more, there's a lot, right? Then we're going to get PAS involved. We're going to get the CERT team involved. So that's sort of how we think about it. And then we sort of have this sort of graphic representation to describe a little bit about these different programs. So emotional support rounding. This is one of those things that can be used at lots of different times. Sometimes when there's a critical incident, the critical incident team is in the process of getting together and providing their services. We might do an immediate emotional support rounding before the critical incident team comes in, Or if the critical incident or team comes in for something, afterwards, after that 72 hours, we might do some emotional support rounding. So this is sort of could be at the beginning or the end or completely separate. If there's a staffing shortage and folks just need a little pick me up, right? They just need that little extra support, right? So something happens and it would be helpful to have somebody come around. As you can see, that the colors are going to change. They're going to go from green to yellow, eventually to red. So individual peer support, which we've talked about, right? Maybe there was a workplace violence event. I was hit by a patient or a patient yelled at me, right? That's something that we would provide individual peer support for. Disrespectful behavior from a team member. We often, help provide support after something like that happens. Or maybe something happened and I'm just a little nervous about my safety at work. I might want to talk to a peer about that. So, right, that's individual peer support. Then group peer support, very similar again, except for a group. And so when there's something that impacted not just me, but my whole team. Sometimes it's a workplace violence event that affects the larger team and not just one person. Maybe a patient dies during routine surgery that we weren't expecting, right? And so that can affect the group. Or a beloved team member dies. Unfortunately, we've seen that a lot in the last couple of years. Or just burnout throughout the group. I'm trying to catch, the questions are going pretty fast. I'm trying to catch some of the questions. We're going to talk about training. I got that one in a couple of minutes. So, so hang on to that and I will answer that question. And I apologize if I missed your question. We will get to it, I promise. Personal assistant service, right now we're in the realm of professional services. And so if I'm grieving a family member death or processing maybe the end of a personal relationship or a challenging personal relationship, I might want to talk to a mental health counselor about that. So that's our EAP program. Maybe I'm a manager who isn't sure what to do about a challenging direct report that I have. I might go for a manager consultation, right? Again, for that EAP program. So, and what I will say is sometimes when I'm providing, and I'm part of the Caring for Each Other program, when I'm providing individual peer support, I might refer to PAS. It's actually a pretty common referral. So somebody might process, and when they process, they might say, great, I'm good. Thank you so much. This was really helpful, right? I'm going on about my day. And sometimes it's really clear that they could use some time with a mental health counselor. And so I'll offer that as a resource for them. So again, we sort of go back and forth. Sometimes somebody will see one of these pieces and then go to another one, and that's totally fine. And then of course our critical incident, right? We have a patient with a gun who's threatening staff or a gas explosion. And so, right, sort of those larger events. I see a quick question. Do you have any peer supports available for patients? Not peer support per se. That looks a little bit different. We do have some coaches and some other folks. We have chaplains who work closely with patients, but it's not this form. That's a good question. All right, so we're gonna move on to our volunteer caring for each other model. So this is where we are actually providing the support to folks. And so we're gonna go through a little bit, and this is where I'm gonna ask you to chat some of your thoughts in a couple of minutes as well. So the first part is listening and seeking understanding. This is one of my favorite pictures. I love this picture. Like this guy is really listening. Love the big ears. So before we jump in, this is the point where sort of folks might be getting a little tired. So I want you to put it in the chat. How do you know when somebody is not listening to you? Just put it in the chat. How do you know when someone's not listening? Other than the fact that I can't see your face. No eye contact on your phone. Yeah, love it. They look distracted. Lots of no eye contacts, texting. I love when I'm on a meeting and like someone's looking at their phone and you can see that they're looking down. And I'm thinking, do you think you're being sly, right? Yeah, right. They don't notice when you stop talking. You're talking and they're not noticing it. Yeah, I love this. Not looking at you, snoring. That's a big one. Yeah, lots of eye contact. Right. The response has nothing to do with what you said. Right. Yes, these are all fantastic. All right. So how do you know when someone actually is listening to you? Let's sort of turn that around. Yeah, these are great responses. Lots of eye contact, nodding heads. Yep. Yep. Engaged. Good eye contact. Replying to the comments. Yeah. Verbal recognition. Absolutely. These are all great. Asking good questions. We're going to talk about that in a minute. Able to engage with an idea. I love these. Repeating backs. Yeah, these are all fantastic. These are all fantastic. So when we think about nonverbal active listening, right? And y'all totally nailed it. This is great, right? The nodding, other head movement, sometimes I'll do this, right? And you can see when I'm looking at the camera or when I'm looking down at my phone, right? The maintaining eye contact, maintaining a calm, expressive demeanor. When somebody's talking to you and you're providing support, you don't want to get riled up because it's not going to feel very supportive, right? So just being calm, sort of listening, right? Being expressive when they say something, your face is moving in an appropriate, expressive way. Sometimes you'll even on Zoom, you can tell when someone's sort of leaning in person. Of course, it's great. Smiling. You're obviously not going to smile in an inappropriate time, but sometimes when you're nodding and smiling, like you're like, I get you, I'm listening, right? So those are all sort of nonverbal ways. And then when we think about verbal and yes, and I'm seeing acting, like a summary of the encounter. Summarizing is a good one. Sometimes, you'll just say, yeah, wow, right? Oh, right. Those little words so that somebody knows you're just responding. I will say that is more challenging on Zoom because you don't want to interrupt. And then it sort of has that funny delay. So sometimes I'll just sort of mouth it on Zoom so they can see that I'm saying it, but I don't want to interrupt what they're saying. Repeating key words. Yeah, I love it. So if I understand correctly, I love that, right? Reflecting back what I think they said, right? Want to make sure I understand. It sounds like, right, this happened or you were thinking about this. Asking relevant open-ended questions. We love what and how questions. If you're asking, have you thought about that? That's not really an open-ended question, right? You're maybe feels a little judgmental. So asking really relevant open-ended questions. What was that like for you? What were you thinking about at that point, right? Those kinds of things. Summarizing, several of you mentioned, right? The summarizing, so gosh, it sounds like when you were in that patient's room, right? And then you sort of summarize what they said. Absolutely, those were all great. All right. So when you're listening, here's sort of some extra tips to think about. And this is, by the way, part of our training for our peer support volunteers, for our Caring for Each Other program. We have lots of time to practice, which unfortunately we're not going to get to do today, but you'll at least get a taste of some of the things that we talk about. So we talked about open-ended questions. How are you doing, right? How can I best support you? Lots of just think open-ended. This is one of the hardest things. I know that you all are brilliant. You want to say the most brilliant thing, right? But sometimes when someone's talking and you're thinking, oh, what am I going to say? Or what question am I going to ask? The perfect question. You're not actually hearing what they're saying. And so to try to turn that part of your brain off, to try to stop those wheels from turning and just focus on what that other person is saying. Because after that, then you'll be able to respond. But if you haven't heard what they're saying, you're not going to respond appropriately, and then they're going to think you weren't listening to them. Avoid interrupting. I know this can be challenging for some folks, but we also sort of want to get our words in. I love that. Listen, speak less, just be present, right? When you're listening, right? The idea is not for you to hold the floor. The idea is for the other person to hold the floor. Avoid criticizing. Some of you may say, oh, I don't criticize, I'm just asking questions. But when you ask a question that sounds like, have you thought about talking to your supervisor? That sounds a little judgy. It sounds a little critical, right? Someone could certainly take it that way. And so when we think about how we even ask some questions, you want to make sure that you're asking, right, very open-ended questions and you're not criticizing. Yes, I love that comment, Christy. Great comment. Allow for silence. So again, really, really hard for folks. We want to fill that space, right? We don't want the silence. It feels uncomfortable to some of us, but I will tell you, silence is amazing. And when you are just there, somebody mentioned in the chat, just being present for somebody, just being there is the best thing you can do. I promise you do not have to say the most brilliant thing. You do not have to ask the most amazing question. If you are just present and listening and truly listening to understand, that is the best gift you can give someone. Love the 10-second rule. I'm trying to catch these chats as they go through. Sometimes I suggest that people actually count to 10. 10 feels like a lot. So if you need to start with 3 or 4, that's totally fine. I will tell you, I've been in conversations sometimes, or group conversations, where I have allowed 8 minutes to go by. It is a long 8 minutes. But sometimes people just need to be in community. They just need to be there. And so I don't want to fill that space, right? I want them to fill it as they want to fill it. Avoid offering advice. I know every single one of you is probably brilliant and you have amazing advice to offer. But in the moment when we're providing peer support, we are not offering advice. We are just listening and validating. Super important, because in that moment, they just need to be heard and they just need to be validated. And so we try very hard. We talk a lot about this in our training, about not offering advice, even in the way of questions, not offering advice. Super, super important, and one of the most challenging things. Maintain focus on the talker, not on your experience. How many times have you been in a conversation where you're saying, oh, this terrible thing happened to me, whether it was my children were all sick, or I had all these things I was juggling, and someone says, yeah, last week I was doing this thing, and they go into their story, and you're thinking, well, what happened to my story? It's really, really important when we're having these interventions to make sure that the focus is on the talker. It's not about me. It's not about I, right? I try not to use the word I. It's really about them. And so we want to make sure that you're really paying attention to that. It is hard, because if somebody's going through something tough and you went through something tough, you want to be able to share your experience, but it's not about you. It's about them. Super, super hard, but super, super important. All right, the next part is validating and normalizing feelings. So the reason that I went through the physical, mental, emotional, etc., was so that you would know how to validate, right? How to validate what's going on. And so just, super quickly, this sounds really tough, and your reaction is normal, right? Someone could say, I am really having trouble sleeping. I'm not even hungry. I don't want to eat, right? And to say, that's actually a common response to stress. Your response is absolutely normal, and I'm really sorry that you're going through this, right? To just validate what's happening. I'm really sorry this happened. Really sorry this happened. It sounds like this is taking a toll on you, right? As they're describing. I'm here for you. Your presence, and again, I can't say this enough, your presence is the most important part of that interaction. All right, so we may think we are saying great things, and sometimes we want to rethink sort of how we respond. So instead of saying, oh no, you shouldn't have said that, right? If someone says, I can't believe I said this, this is what I said, and you might be thinking, I can't believe you said that. You don't want to say that, right? You're validating. So, wow, what happened after that? You're listening, you're validating, you're supporting. I understand. Last month, I had a patient who, right, that's making it all about you. It's not about you. Can you say more about what you meant when you said, or can you tell me more about that experience? I know exactly how you feel. I guarantee you, you do not know exactly how that person feels. You might think you do, but you don't. How do you feel about that? Right? Just ask them. Just turn it around into a question. You are strong enough to get through this. I have heard that so many times, right? It's really, all of these are really well-meaning, right? You're so strong. This happened. There must be a reason, those types of things. And the problem is that the different people feel differently about stuff like that. And this feels like it could be supportive, but actually maybe I don't feel strong. Maybe I don't feel like this was meant to be. And so you don't want to put that on somebody. So just to say, it sounds like this has been really tough, right? Again, you want to validate what they're feeling instead of telling them, right? Giving them advice or telling them what you think they should be feeling. I think you should. What are you thinking about doing next, right? Again, just turning those things into validating statements or into open-ended questions. So just want to, think about some of those. All right, self-care. So super important part. I will say in our intervention, we spend most of our time on listening and validating. Those are the two of the most important parts of this. And then we spend a little bit of time on self-care and a little bit of time on referrals, which we'll do next. And that is our model. That is what we do. So really, really simple. It's what we train people in. It's what we do when we're providing support. We try to keep it very, very simple for folks. All right, so self-care, engage in self-care and help others. So I would love for you to put in the chat, what do you do to engage in self-care? Everybody's different. Everybody does something different, but would love to. Naps. I love it. That was the first one, but you're awake now, so that's good. Journal, walk, garden, belly dancing. Love it. Yeah, lots of different types of exercise, meditation. Love all that. Zumba, Binge TV, absolutely, right, all over the map. We want to encourage people to do self-care. And so what we do is we ask them about it. You know, what are you doing today? Or what can you do for your own personal well-being, for your own self-care? Take time to process or just to breathe. Sometimes we're running all day, right? And it's really important to remind people to take a breath. Just take a breath. Sometimes go outside. Yeah, if you're into yoga, do yoga. If you're into meditation, do meditation, right? Take a time out. Sometimes I'll just walk down the hall. Gotta go for a sec. Walk down the hall. Right? Take the breath. Come back, right? Sometimes it's just 30 seconds. I mean, it can really be that short. Take time off. I know that every single one of you is so critical, right? That you feel like you can never take a moment. You always have to be on email. I'm telling you, you may feel critical and you are critical in so many ways and you're so important, but it is equally important for you to take time off because you can't actually bring your full self to work and do your work effectively if you don't take breaks, if you don't take time off. And so I really encourage folks to do this. And when you're off, to actually be off. Super, super important. Yeah, love the tap out to a coworker. Absolutely. All right, engage your support network and support others, right? Making sure you, whether, it doesn't matter if it's a dog, a friend, a spouse, a parent, a child, an aunt, right? Anybody who is in your support network. And then offer that support to others as appropriate. This is me and my pandemic puppy. Love little Mozzie. She is moments of well-being every day. She's always so happy to see us and always so happy to give kisses and hugs and super fluffy, right? Whatever well-being looks like for you. It could be a pet, it could be a spouse, it could be a friend, it could be a walk, it could be Netflix, right? Whatever it is for you, make sure that you embed those moments of well-being and utilize available resources, which brings us to the refer. All right. Lots and lots of referrals. These are internal to us. I'm sure y'all have similar things, or at least some things. We have our EAP program. We have chaplains in our inpatient hospitals. Lots of website resources. We're actually in the process of retooling our website to make sure that we're making it easy for folks to find. We have a career center. We have our reporting system. We have human resources, including Office for Institutional Equity. So lots of internal resources. You just want to know yours and be able to provide them. There are also lots of external resources. Two of our big ones that we refer to are the National Suicide Prevention Line and the Crisis Text Line. For folks who want to talk or for folks who want to text, we sort of cover both of them. So we always offer a referral as appropriate when we're doing caring for each other peer support. This is another resource that we offer. So it's a coping card that we wrote. Actually, the front is just ideas for self-care, and then the back are some of our internal resources with a QR code that takes you to our website that I actually think we have to update. But this is just an example. It's a 4x6, so we hand it out when we do emotional support rounding. We have it electronically, so lots of ways for folks to get the information. And then this is a bookmark also that we give out during emotional support rounding. We also have this online, very similar information. You can see our 24/7 CEO Caring for Each Other support line just for internal folks. So just something else that we hand out. On our website, this piece actually is in process. We're working on it. We are trying to figure out, when somebody's overwhelmed, the last thing you want to do is say, here's a page with 25 resources, go for it. Because I guarantee you, they are not going to look at any of those 25 resources. So we want to make this as easy as possible for folks to find the right resource. It's why one of the things that we talk about in our peer support training is making sure that we're offering one resource at a time, right? We sort of assess what might this person benefit from, and we offer one resource. So this is just a way on our website. We're in the process of formatting this of what type of resource am I looking for? And then I get to choose as a user. Am I looking for support or guidance or training, right? And then it will take you down that decision tree. This is another page on our website that gets you to some of the same resources, but just in a different way. So someone can look at that and say, I'd like some courses and training, and go right there. Or I'm a leader, I'd like to look at your leadership tools. And so, right, you want to make sure that you've got just different ways to make it as easy as possible for folks. Okay, extra tips. You don't need to know all of the details. Many of us are used to diagnosing in some way, whether it's medically or mental health component, right? We're used to diagnosing. It is not important who the person was with exactly what happened in the circumstance, right? Any of that does not matter. I know we may be tempted to ask those details, but we don't need to. It's really what that person wants to share and us being there, listening, validating, right? Talking about self-care and referrals. So super important when you're asking questions to really think about those open-ended questions where you're not saying, so what happened after that? Well, who was with you? What time was that? What unit were you on? None of those things matter. Did he hit you on the left side or the right side? Doesn't matter, right? Did he hit you 3 times or 5 times? Doesn't matter. If you're diagnosing, you're going to want to know, is the pain going up? Is the pain going down? Which arm, right? If you're diagnosing, but we're not diagnosing. And so we just want to keep that in mind as we're having these conversations. Reflect the story and then the emotions, right? So to say, wow, like this happened, right? You're sort of doing that reflection. And then that sounds really hard, right? I'm really sorry that happened. Listen to understand. Think about my little friend with the big ears, right? You're not just listening. You're listening so that you can really understand what's going on. You can really get that other person. And the only way to do that is to make sure that the ears are big, right? And I think someone said something about how we were created with 2 ears and 1 mouth, right? So listen twice as often. Slow down and use silence. We are used to the running. Right, when you're in these situations, in these conversations, take a breath, right? Use silence, slow down. It doesn't have to be 3 minutes. You might need 10, you might need 20. Make sure that you're providing the time to provide support. Avoid using I, we've talked about that. I'll stay off my soapbox about that. Ask, don't say, right? When we say the have you thought about, right? That's sort of offering advice in a funny way. So you want to make sure even when you're asking those open-ended questions. And then make sure you're accessing support and help. As providers, as folks who are providing these services, we want to make sure that our people are also taking care of themselves. They also have support. And so we really want to make sure that we're saying, you know what, these services are for y'all too, right? It's not just for the people who we serve, because we also need to make sure that we're being served. And so want to just make sure to plug that. All right, somebody talked about the training. So we have a 2-hour training. It's not nearly long enough, but it's what we've got. So we, for 2 hours, cover these things. We talk about the programs and roles really briefly. We talk about active listening. So I went through some of that with you. And then we actually practice those skills. We practice active listening. I'll tell you, some people say, no one's listened to me for 3 minutes straight. I can't even remember the last time, right? Really, really super helpful, both for practicing and for recognizing the power of listening. We talk about psychological first aid, and we covered a little bit of that today. We go a little bit more in depth. Resources and referral process. So we talk about those resources that I mentioned and how to send folks to them. Lots and lots of practice, as part of our training. And then we actually have one-on-one booster sessions. Generally, they're 15 to 20 minutes. Sometimes they're a half hour that are just one-on-one with one of our staff members to make sure that folks get the practice in. After that, they actually, we ask them to practice within their groups for a couple of months, just practice these skills, and then to come back and apply to be part of the actual program. So you can care for each other, right? Our program is called Caring for Each Other. You can do that without being an official member of the team. We want everyone to go out and care for each other. So that's how we set up the program. We also have, and I'll talk about that in a second, we're going to start having quarterly meetings. All right, so managing our volunteers. We got this started about a year ago. Lots of folks, our classes are generally pretty full. So we have lots of folks super interested. We want to make sure that we're providing an easy and accessible place for all of these materials. We update our resources all the time. Over time, we've updated our training a little bit. We sort of tweak it here and there. As the program has gone, we update things. So we use Teams. That's why you have the icon over here. We use Teams, and so we update all of our materials on Teams so that our volunteers don't have to search through their email. When was the last time, Melissa or somebody else sent me the resource? It's all right there in one very easy to find place. We remain in periodic contact with volunteers. I'm actually, in the next 24 hours, going to send out a message to our volunteers saying, hey, here's some changes that we're thinking about, and invite them to a quarterly meeting. Practice continual booster training, right? Opportunities to practice when folks haven't done this for a while. practicing talking through situations can be super helpful. We cannot forget to thank and recognize our volunteers. Super, super helpful. Sometimes it's just a quick thank you. I really appreciate you reaching out to that individual. It's great if you can to have sort of a once a year gathering. I know that's been tricky with the financial climate and COVID, but to the extent that you can thank your volunteers, we got some swag at some point for our volunteers. So anything you can do to thank and recognize folks for doing this work is super, super important. Okay, so our role in prevention. I wanted to spend most of the time today really talking about the program. However, we can't just focus on providing support. We have to also think about prevention. And the reason is that if I'm a nurse on the floor and I've been hit 5 times in the last 2 months, how do you think I'm going to feel if somebody reaches out to me again and says, I'd like to support you now that somebody's hit you again, right? We have to really think about, and it's a silly small example, but we have to really think about when there are systemic issues, when something's happening a lot, how do we think about changing that structure? How do we think about prevention, right? How do we address that? So the first is we want to recognize common concerns. Actually, a couple of weeks ago, I was talking to one of my colleagues, and we realized, a lot of people in this particular job category were not feeling included on the units. And it seemed it was more than one. It was 5 or 6 right in the last couple of months. And so we actually approached the leader of this particular group of employees and said, hey, this is what we're seeing. Would love to partner with you and figure out how we can address the problem. So you want to recognize those problems, right? Anything that has an intense impact, even if it doesn't happen a lot, to recognize those concerns, escalate as appropriate. We're very careful about the escalation because the purpose of the program is not to escalate. The purpose of the program is to provide support. So that's where our focus is. However, when there are issues, sometimes I'll say at the end of a conversation, I'm hearing what you're saying, and this is something that's really, really important. I'm wondering if it would be okay if I share this information without attribution, without your name, because I think other folks may be experiencing some similar things, and I want to think with our leadership about how we can address that, right? And I will tell you, lots of folks say, oh yes, you can even use my name. I generally don't. Anyway, so we use that tool when appropriate. And then if it's appropriate to engage the person or people harmed, sometimes we'll circle back, sometimes it's not, it depends. Again, we want to make sure that our primary purpose is support, but we also don't want to just leave it there because we have to think about structural issues. We have to think about prevention. And so, right, circling back is a key piece of that. All right, key takeaways, and then I'm going to unshare my screen and happy to answer your questions. So healthcare team members face a variety of personal, professional, patient-related stressors, right? Lots of stressors. We all respond in different ways with different symptoms, physical, emotional, et cetera. And we benefit from a variety of service options. It's why we offer lots of different options. And we work together to make sure that, right, we're not overlapping and that we're communicating. Super important, listening and validating team members is so crucial, right? Listen and validate. And then a successful and comprehensive program should include both emotional support and prevention. So those are just sort of key takeaways. I will stop sharing my screen and happy to answer any questions that y'all have.
Thank you so much, Melissa. You were worth the wait for the postponement from last week, but great both individual and programmatic tips. So just wanted to call that out. So definitely a lot of questions. I'm going to try and group them in somewhat of a logical order. So a bit more of like process questions for the volunteers. So how many volunteers are needed? There's a specific question regarding the phone coverage.
Yeah.
And then just in general, like the guidance on sizing of your program. So how many volunteers are needed? Do you have someone managing the schedule? Kind of what does that process look like?
Yeah, it's a great question. So what I will say is we're still new. We're about a year old. And so we are constantly tweaking, adjusting, right? We sort of try something, we tweak and adjust. So anything that I say, we've sort of moved depending on what's happening and the responses that we get. So we have, gosh, I should have looked up the number before I started. Probably, well, we have over 100 people who've been through the training, well over 100 people who've been through the training. I would say we have an active group of about 30 to 40 volunteers, depending on the site. We have a larger group of probably closer to 60 to 70 volunteers who sort of occasionally jump in to help. We have Caring for Each Other program managers at a couple of our sites, and we don't have them at all of our sites. And so I work centrally, and we have a Caring for Each Other program manager who works with me centrally. And so we help provide services to those sites who don't have program managers. The ones who do, we try to have them managed locally to the extent that they can. We jump in as needed and are happy to do that. So it sort of depends on our biggest hospital has a Caring for Each Other program manager who works full-time on that program and has a whole cadre of volunteers. One of our other hospitals also has a full-time Caring for Each Other program manager. So sort of depends on the site. In terms of the 24/7 line, we got very creative because we knew there was a need and we knew we needed to hold it up pretty quickly. So during the day, it goes to the people who would normally take those during the day. And that's so folks who work sort of the 8 to 5 shift. At night, depending on the site, it goes to different people. So we have trained Caring for Each Other folks. Many of the folks who cover at night are chaplains who trained in our model and who would be on call anyway, or on call at least sometimes. And so they can cover for the overnight issues. And on our phone line, it says, if this is urgent, press 1. If this is not urgent and you want to talk to someone the next day, press 2. So even somebody who calls at 9 p.m., it might not be urgent and they can press 2 and don't need to call somebody overnight. So we're still tweaking that system, but that's where we are now. And we literally just started this a month ago. So we'll see how the numbers, how many calls we get and what happens. And it's possible we will need to hire somebody at some point for overnight, but right now we're partnering with our friends and colleagues to make that happen.
Got it. So kind of a follow-up to that from an infrastructure perspective, it sounds like you have a program manager at each site. Like
not all, but it's some.
Okay. And then like, do you have your own budget? Who oversees this? Like, how is that kind of set up from a system perspective?
We don't have much of a budget. We do have a budget for chocolate. That's part of our budget. It's really staffing. I mean, the staff is the biggest piece of the budget. So that's where the money goes, not really for anything else other than literally chocolate. We need name badges. I mean, nothing. The program does not, because we have volunteers. Right. And so we try to really include our volunteers. And what I will say, there's no pressure on our volunteers. So just because somebody volunteers doesn't mean they're expected now to do a certain number of interventions. We want to make sure we're taking care of our people.
Got it. That makes a lot of sense. It sounds like this program is still pretty new, but any data on the success of it or anecdotal, just what you see as successful truly out of a lot of the services that you offer?
We have a lot of anecdotal data of people just saying, this is amazing. This was so helpful. I have some emails like, thank you so much for talking with me. This was really amazing. I had no idea this was a thing, right? So I get a lot of that. We also actually keep data on all of our interventions. So we were using different systems across the health system. We recently combined, which I'm super excited about. So we have now one data stream across the health system. So within the next couple of months, we'll have more robust data from that. Lots of people using the services, lots of people super happy with the services, but we're in the process of sort of getting more robust data. But I will say we have a new Caring for Each Other program manager at one of our hospitals. Within a month and a half, she was so busy. We were talking about increasing staffing. So it's a service that's very much needed and very much used.
Great. And I think I'll end with this question. This person says that there's really no program besides EAP available. And they want to start a program similar to yours. So what is the best place to start? Or maybe another way of thinking of that is, what is a big bang for your buck that you saw from setting up and implementing these programs and offerings?
Yeah, so if there isn't pull to have a separate program, I will say that it's possible to do it from within the EAP program, to have somebody in EAP help train volunteers and run that program of volunteers. As long as it works with your system and folks would use that service, I think that's fine. And again, I work really closely with our EAP folks. So I'm sure that there are EAPs running this type of program.
Yeah. And actually, I'm gonna ask one more. No,
Yep.
I'm not gonna laugh you off.
Sure, no problem.
I think this is a good one. So are there any problems from leaders providing their staff as volunteers in terms of just time away from work or time focused on this program?
Yeah, that's a great question. We always get permission when someone wants to be a caring for each other volunteer. We actually ask them to give us their supervisor's name, and we ask, but we don't require a lot of time of any one individual. We make sure that it feels very manageable, and someone could do it during work or after work. It's up to them, but we do get permission. We don't want to step on anybody's toes. Yeah.
Got it. Thank you so much. I'm going to pull up just kind of the final reminders here. And as I'm doing that, I'll ask that Rachel chat in the notes here. So you might not, my presentation mode keeps getting messed up, but essentially, please complete the evaluation form that will appear on your screen once the webinar ends. It'll automatically take you there. We really value your feedback on the webinar. And so please complete that. It'll just take you a few minutes. And then again, for CE credit for today, Rachel can chat in the instructions to create a Duke OneLink account if you have not done so. But in order to claim your credit, you're going to text that LUTVUB to the number you see there. So I just really want to thank you all for joining us again. And thank you so much, Melissa, for a really helpful presentation, really specific, good takeaways. And so with that, I'm going to end the session today. And thank you all so much for joining.
Take care, everybody. Thanks for having me.
Bye.